Hi, my name is Jason Edwards, and this is Doc Discussions, Episode 4. I'm with renowned OBGYN, Dr. Daniel Wagner. One of the things that you've told me in the past is that your father was an orthopedic surgeon. Is that right?
He is. Yeah, he was. Yeah.
And so he had to have been part of the reason that you got into medicine, I would assume. Is that accurate?
So yeah, strong influence. I mean, he would come home exhausted, but had a great day at work, and would just get up and lather, rinse, repeat. Would go back and do the same thing day in and day out, and he just loved it. Interestingly enough, I've got an older brother who's an OBGYN also. So neither of us went into orthopedics, which my father had done. And so he thought he'd done something wrong, But I always tell people they're very, very similar. In orthopedics, which my father was, someone comes in with a broken hip and you fix them and you take care of the family and you take care of them for years. And it's a lot like what we do in gynecology. I see somebody for years and years. I deliver their babies. I get them, through menopause. I take care of them for years. And it's wonderful. So we have that same long-term bond in it, and they're very, very similar.
Believe it or not, if I wasn't a radiation oncologist, I've often thought I would be an OB-GYN.
Yeah.
Because you have that same long-term relationship with the patient, and you know them, you know their children, and that's a nice perk to have. I mean, if you like people, it's a good profession to go in, and there's plenty of breadth. I mean, OB-GYN it is a huge span, whether you're doing cancer surgeries or you're delivering babies or preconception stuff, and so it's a giant field, and I think it's fascinating. Is there an area where is your practice, is it specialized in one area, or do you have kind of a general approach?
I still do general, and so it's probably 50-50 GYN and OB.
Okay.
I'm smirking because the last patient I saw before coming down here, she's about 38 weeks pregnant, and I delivered her 25 years ago from her mother. And so she's going to be the 20th patient that I've delivered who I delivered from the mother. And so by definition, that's making me old. But that's that whole longitudinal span. But and that's what I really, really enjoy. But no, it's a great mix because it's gynecology and obstetrics, and it's office and it's hospital based. You do surgeries, and like the orthopedics, if they've got a problem with gynecology, you fix it, you make them better, and it's very happy, and it's a great specialty.
Yeah, and you guys do a lot of surgery typically. I mean there are some people who specialize and don't do that, but there's plenty of surgery in your training and then in your practice too.
Yes, yeah.
And it's nice I think to be in the OR some and be in the clinic some. I think it gives you longevity through your career.
Is that what it's giving me?
Yeah. That's why you're low mileage, Dan. Even though you've delivered a couple thousand babies.
Several thousand. Yeah, we think it's just over 4, short of 5.
Okay.
Yeah.
Yes. And so and counting, right?
No, I'm not keeping track. I should have, but it's too hard to go back now.
Very good. And so, what was it initially, do you think, that pushed you into OB-GYN?
It really was the continuity in care with the patients. And I was thinking surgery first.
Yeah.
And so the fact that it was a surgical subspecialty and I could get into the OR and do surgery, and then the long continuity of care. So that's what really attracted me. Truly, as I was going through medical school, I had the older brother who was the OBGYN, and I thought he was crazy. And he's like, "Oh, wait till you see." And when I couldn't decide what to do, he was the one who said, "Well, where'd you have the most fun?" I'm like, "Oh, I had a ball on OBGYN." He's like, "I told you." And so a couple more rotations that 4th year of medical school kind of solidified it.
Yeah.
But the worst part, when I was a medical student, one of the OBGYNs who's here was a chief resident when I was there and almost swore me off of it, Mike DeRosa.
Oh, Mike DeRosa. Yeah. Talk about ageless.
Yeah.
Mike DeRosa. Man.
Just keeps going, but he was a chief resident and I was a medical student, and I'm only joking because we had a ball, and he was part of the whole thing that was just so much fun. And you'd stay up night, you'd deliver babies, you'd be exhausted, and you'd come back the next day just like my dad, excited to do it again.
Yeah, I can see you and Mike getting along well because you both have a good energy about you. It's palpable when you walk in the room. Good smile, fun guys, and so that's funny and not surprising that you guys were good friends and probably still are.
Still are.
Yeah. As far as things that you do outside of work, what are you interested in?
Well, for fun things, I love fishing. I'm a big fly fisherman.
Is that right?
Yes, and it's fun. And gotten into like tying my own flies to fish with.
Okay.
And my children used to, my wife would say, "Where's Dad?" And the kids would say, "He's downstairs making bugs." And I'd be tying flies and then going fishing, and that's really relaxing, very peaceful, and so not necessarily. I do have some trout fishing, but a lot of it's just on a farm pond and plunking away and catching bluegill left and right.
I've pulled some big fish out of farm ponds.
Yeah.
I mean that can be a honey hole, as they say in the fishing biz.
You're right.
And so I've done a fair amount of fishing in my day, and I talked to a guy once, and he said, "Well, what kind of fisherman are you?" And he kind of had this like snooty vibe to him, and I knew where he was going. I knew he was going to say, "Well, I'm a fly fisherman." And so I asked him, I said, "Well, where do you go fishing at?" And he goes, "Rockbridge." And Rockbridge is if you don't know,
shoot 'em in a pond.
It's like shooting fish in a barrel. Like the people who own Rockbridge, they don't make money unless you catch fish. So you're walking out of there with a fish.
You are.
So anyway,
by the pound.
Yeah. And so anyway,
no, it's fun. It's very relaxing, and it's always, especially if you like trout. Most of the trout are in very beautiful places, so you get out and you do that.
Very much.
And
so.
I do get out and do some of that trout fishing out west too with family.
Is that right? And do you have to tie different flies that are kind of in the area that like
you can, but they don't like my flies, so I buy them at the store.
Buy them at the local store, right?
Right. Yeah.
Because what works in one place may not work in the other. Is that right?
Right.
There's something too, just kind of getting lost in something, whether it's a book, or going swimming, or going for a run, and just kind of forgetting about like a lot of things that are going on. And I think that's such a healthy thing to do from time to time. And before I use the word meditative, but it's important just to kind of like let things go and have your domain where you can go and just kind of reset and get your mind right. And so when you're dealing with some high stress situation the next day, you know, you're dialed in.
Well, and I do think it's important for someone for people to make something, to create something, to do something good. I mean, there's always a benefit to that, and everyone's got a hobby and a niche, and they can do something and make it, and there's great satisfaction in that.
Yeah.
You find your love and you do it well, and it usually if you produce something, it's really neat.
I totally agree. When I was a kid, I would like go and like mow people's yards for like $7 a pop, which has to be a deal these days.
I was going to say, are you available?
Yeah. but I would just look at the yard and be so satisfied with myself. And there is something that's just inherent to us that very much likes creating something or doing something or making something better. I once kind of went on this journey where I tried to figure out like what's the meaning of life, and that can take you to a lot of different places. Yeah. But my final conclusion was find the things that you care about and try to make them better. And medicine's a great place to kind of cultivate that mindset and try to make things either less bad, because sometimes you're just making things not as bad as it could be, but it's still a tough situation, or to make things better. And I think it's important to realize that people are consequential in this world, and you can make a difference. And it's not being nihilistic and saying, "Oh, we all turn into dust," is not a good way to be.
And it's often not even in medicine. Sometimes you just listen to someone, you ask them, not even a medical question, how they're doing, or I try to keep track of my patients and their family, and if I know their husband's been sick, I want to know, how her year's been. Sometimes you find out a lot of people when you ask them non-medical questions, and you get into that. That's really good.
And many times you can serve them more, talking to them about their grandson or some other way than their standard visit. And I feel like, well, if somebody goes to the doctor down the street, medically they're going to do something very similar to what I do, but you feel like you're really adding value if you're kind of doing that extra thing and trying to, not only treat their condition, but try to make their life better if you can, which is sometimes hard to do. But it's always good. A good challenge is always something that we all need in life. Well, Dan, thanks so much. I always enjoy talking to you, and I appreciate your time. And thanks for coming on.
You're welcome.
Coming in for the talk.
Thank you. Good.
Yeah.